On the 10th of March this year, the Ministry of Health rolled out the COVID-19 vaccination process in Uganda after receiving 964,000 doses of the AstraZeneca vaccine. The first stage of the vaccination exercise targeted around 2 million essential workers, including teachers, health workers, as well as members of the armed forces. The core of this exercise required the provision of consent forms to all participants to show that they had consented to be vaccinated. As of today, over 60,000 of the registered 150 health workers have so far been vaccinated against COVID-19, which has raised concern among some political leaders. In response, the Amuru Resident District Commissioner, Geoffrey Hethbon-Ocheng, has moved to force health workers in his jurisdiction to take up the job in order to drive up the numbers. But this move has prompted the Uganda Medical Association to express disappointment with the directive.
This will imply absence of consent in an activity that should be voluntary.
Dr. Idro insists that actions by the Amuru district leadership in seeking to withhold health workers' salaries until they are vaccinated is a violation of their rights and should be condemned.
Having people to consent for vaccination is not because the vaccine is unsafe, no. Rather, it is ethical, and like every form of treatment or intervention, it requires consent.
He is calling on the ministry to step up its sensitization program or risk legal redress from the affected health workers.
Educate the public and especially the health workers to understand the safety and accept the vaccination. Vaccine hesitancy from the health workers could create more hesitancy from the wider public.
In response, the Ministry of Health has denied any knowledge of this issue.
We do not believe in any form of coercion, and we hope that the allegations being raised against local governments are false.
Contacted about this, the Amuru Resident District Commissioner, Geoffrey Hethbon-Ocheng, acknowledged making the order against the health workers, but then could not give a detailed interview as he was in transit. Reports from the Ministry of Health indicate that the COVID-19 vaccination has largely been taken up in the districts of Kampala, Wakiso and Mukono, while some like Siriri, Nakaperipit, Amudat, Buko as well as Sironko are still lagging behind. JoyceNakato, NTV Tonight.